Hi, I'm Dr. Lynn Baxter, and I'm Director of Breast Imaging for Northside Radiology Associates here at Northside Hospital. As most of you know, October is Breast Cancer Awareness Month. So what we're going to do today is talk about some of the common myths relating to breast cancer and hopefully be able to debunk those for you. That is probably the most common myth about breast cancer that I hear from patients when I'm working with them. And the truth of the matter is that about 75 to 80% of people who get breast cancer don't have any family history. And that's why it's really important for all of us to get our regular mammograms, to get our regular checkups. And if we notice any symptoms of anything being different in our breast, to really check it out with our doctor. There are some breast cancers that run in families. You know, we have identified some genes with gene mutations or problems with the genes that can be passed down through the generations. And those can make certain people very likely to have a breast cancer, but that's only maybe 10% of breast cancers that have that. So most people, it's not related to having a family history of it. The important things with the family history too is it can come from your mother's side or your father's side. So if you have a strong family history on either side, you may want to talk with your doctor about getting tested for one of those genetic issues. These are urban legends or internet rumors that get started, and then some of them really take off. And you know, particularly things like the antiperspirants or wearing bras, it's out there that this is going to block the lymph flow out of your breasts and hold toxins in the breast and cause breast cancer. And it's just not true. All of the studies that have been done on that have shown no link between these things and breast cancer. And to me, it's really upsetting to have those kind of myths out there on the internet, because I run into so many patients who believe them. And, you know, ladies who will get diagnosed with breast cancer and say, oh my gosh, if only I hadn't worn antiperspirant. And that, to me, that's really doing so much harm, because nobody ever does anything that causes them to get breast cancer. It's not anybody's fault when they get breast cancer. And I really would like for people to pass along the word that there's nothing anybody is doing or not doing that's making them get breast cancer. Definitely a lump can be a sign of a breast cancer. There are other signs too that people should be aware of, such as bleeding from the nipple or something that's pulling in the skin or pulling in the nipple. But actually, most people who have breast cancer don't have any symptoms of it. And that's one thing that's really important, is particularly for early breast cancers, exactly when we want to find breast cancers, usually people don't feel a lump. And that's what's so important about mammograms, is that we can find breast cancers when they're really small, before they're big enough to form a lump or to do anything that anybody would notice on their physical exam. The other part about that is, I know anytime somebody does feel a lump in their breast, a lot of times they tend to think the worst and be really, really scared that it's going to be a breast cancer. And while some breast lumps definitely are cancer, most of the breast lumps that we see actually are not cancer. You know, we can clear them as little fluid-filled cysts or other things that are not dangerous at all. So anybody who feels a lump should not be afraid about getting it checked out, because most of the time they are going to get good news. We don't know exactly what causes breast cancer, so we don't know exactly how to prevent it. In terms of the vegan diet, that I think got started because years ago there were people who thought that, you know, there must be something related to the diet, because you look, for example, at women in Japan whose diet does not contain a lot of red meat and does not contain a lot of fat, and they tend to have lower rates of breast cancer than people in the Western world, you know, where we're eating our Western diets. So they thought it must be related to diet, but there have been many, many studies looking at this, and it hasn't really panned out. And, you know, it's so complicated what might be causing breast cancer in terms of your genes, but other things in the environment and all sorts of things like that. So there is some good literature that shows that for women after menopause, maintaining a healthy weight can reduce the risk of breast cancer. Being really overweight after menopause can increase the risk of breast cancer. There's also good evidence that particularly after menopause, being active, you know, exercising even a little bit every week can decrease the risk of breast cancer. So those are some things that can help. But in terms of the diet, there's nothing that's really been found to be this is great, this is what's going to cure it all. that's something we want to be sure that people understand as well, because we don't want everybody to think, oh my gosh, I should just have my breasts removed and that will be it. You know, there are some ladies who carry the genes that put them at very high risk for breast cancer, who will, after consulting very carefully with their doctor, decide to have their breasts removed. That, in those really, really high risk cases, will decrease the risk of breast cancer by about 90%. But even in those cases, it doesn't completely remove the risk of breast cancer, because there will always be some cells, you know, right under the skin or right along the chest wall. They can't get every last breast cell out, even when they're removing both breasts. So, you know, for a small percentage of people, that might be something to think about and discuss really thoroughly with your doctor before making a big decision like that. But for most everybody, not something that really is a good thing to think about. Breast implants, whether they're silicone or saline, silicone gel, none of those have been shown at all to increase the risk of breast cancer. It is important for ladies who have breast implants to let their technologist know when they're going to have a mammogram, because the implants can sometimes hide parts of the breast tissue, and the technologist will be able to work with them to try to get extra special pictures to help us see as much of the breast tissue as possible. One thing that people should be aware of in terms of breast implants, not at all related to breast cancer, but very recently there have been some studies that have shown a very rare kind of lymphoma, a cancer of the lymph glands, that can be associated with some breast implants, particularly ones that have rough edges as opposed to the ones that are smooth in terms of the implant edges. So if someone who has implants does notice swelling or a lump or something that's unusual or different for them, they would definitely want to check that out with their doctor. While most breast cancer is in women, about 1% of breast cancer does occur in men. And it is as treatable as breast cancer in women. But the unfortunate thing is, if a man feels a lump, a lot of times he's kind of nervous to come in and see us at the breast center and get that checked out. But he really should. You know, just like in women, most times when men feel a lump, it is not a breast cancer. But in men, the cancers tend to get diagnosed later because the men don't come in early enough to get it checked out. So definitely for men, if they feel something or notice anything that's different about their breast, much better to get it checked out and hopefully get some good news. Mammography, like every test, there's no test that's perfect. You know, in order for us to diagnose a breast cancer early, we have to be able to see it on the mammogram. And sometimes just based on where the cancer is growing, if it's in a part of the breast that is just so far out of the picture that we can't see it, if it's not on the picture, we won't necessarily find it. You know, sometimes there are things like dense tissue or implants or things like that that can block certain parts of the breast and we can't see them on the particular mammogram picture. And sometimes there are certain types of cancers that just grow in a way that doesn't form a lump or doesn't really deform the tissue or doesn't do anything that's going to show up as a different pattern on the mammogram. Fortunately, this is a small percentage of breast cancers. Most of them we are able to see early with the mammogram. And mammograms far and away are the best test for finding breast cancer. They are, you know, it is the only test of any kind that has ever been shown to reduce the risk of death from breast cancer. 30 to 40% decrease in death from breast cancer since we started doing mammograms. So it's not a perfect test, but it's a really good test. And the studies have definitely shown that doing it every year instead of every other year or that sort of thing is really the best way to find the earliest breast cancers. You're going to save the most lives with a mammogram every year starting at age 40. That's another one that we wish were true, because I know nobody likes the compression that goes along with mammogram. But unfortunately, the mammogram is the only test that's been shown for screening to save lives from breast cancer. And it really is the best test that we have. Ultrasound is something that we will definitely use frequently in addition to the mammogram. If there's something we see on the mammogram that we look at a little more carefully, if there's something that somebody feels or has a symptom that we want to look at in another way. But as a screening test, it absolutely cannot replace the mammogram. Sometimes people want to do it if they are higher risk or if they have dense tissue in addition to a mammogram. Even in that situation, it's not the best test. There are some people, such as people with high risk because of family history or genetic issues, or some ladies with dense tissue who are looking for additional screening beyond a mammogram. In those cases, MRI is absolutely the best test in terms of that additional way of looking. The mammogram looks very, very nicely at the anatomy of the breast. The MRI, I don't know if you can see, we have an MRI over here. MRI looks at blood flow patterns in addition to the anatomy. So that looks at things in a totally different way. It can help us find cancers that might be hidden on the mammogram. So really for the higher risk people, that combination of mammogram and MRI is the best thing we have in terms of finding most cancers. Ultrasound can occasionally pick up an additional cancer, but nowhere near as many as the MRI. So that's why we really recommend those two as the combination for people who need something extra. And that's one of the myths that perhaps the most important myth that I want to debunk in terms of breast cancer. Thermography is not something that is a good test for breast cancer. And that's another thing that makes me really unhappy when I see this being marketed as holistic or better for you or an alternative to mammography, because that is just really misleading and dangerous for women. Again, the mammogram is the only test that's ever been shown to decrease the risk of breast cancer, decrease the risk of death from breast cancer. I think they try to play on people's fears about mammography, and radiation and compression with that. Mammograms are so safe. It's safe to use even in women who are pregnant. The radiation level is so low with mammograms. Thermograms, they say, are holistic because it's just measuring heat differences in the breasts, and people think this is better, this is safer for me. But the problem is it's not useful. It doesn't give any useful information. If a thermogram is normal, it means nothing. You can have a huge cancer. If a thermogram is abnormal, it means nothing. You may have nothing going on with you. It is not approved to be used separate from mammograms. And to me, it's really misleading and bad for women, because if they have a thermogram that shows nothing, it means nothing. They've paid their money for it. They have to get a mammogram anyway. Same thing, if it shows something, they're going to get all upset about something that is potentially nothing on this test that's meaningless, paid their money for it, and still have to get a mammogram anyway. So to me, it's really doing a disservice to women who are trying to be in charge of their health and really do something healthy for themselves. But the best thing they can do is their mammogram every year. I'm Dr. Lynn Baxter. Thank you so much for joining us. I hope this was able to give you some better information about common myths about breast cancer. Please share with your family and friends. I do want to mention October 15th is National Mammography Day, so a good time to think about getting your mammogram. But really for us at Northside, every day is Northside Mammography Day. We are happy to see you at any time and provide you with complete breast imaging services.